You'll join me. Father God, we just come to you right now and we thank you and praise you for just how great you are, for choosing to love us. Lord, we pray for your wisdom right now in this room with this governing body. We pray that you're with each and every individual county employee and their family, that you just keep them safe and healthy. And Lord, we know that you are God and that you have this and that we can keep that faith in all that we are facing. We pray for our national and our state and local leaders, Lord. We just thank you for the men and women that are protecting this great nation. And Lord, most of all, we thank you for your son, Jesus. In his name we pray. Amen.
Okay, first item, approval of the agenda.
Second.
Have a motion and a second. All in favor?
Aye.
Aye. Motion carries. Approval of minutes.
So moved, Madam Chair. Second.
Got a motion and a second of approval of the minutes for the January 15th, 2021 special meeting. All in favor? Aye. Any opposed? Motion carries. Informational items. We've got Roosevelt General Hospital update, Ms. Kay Green.
Not now. Okay. Good morning, everyone. It's my pleasure to be with you all today. Normally, when I come to this group, I'm asking for something, and I'm glad to say that today I'm not asking for anything. I just want to give you an update on all of the activities we've got going on at Roosevelt General Hospital. And I'm also going to give you kind of an update on COVID-19 from what we're seeing at the hospital level. So I'll start with the COVID update. And please, if any of you have any questions, feel free to interrupt me along the way. I've got current statistics as of Sunday night. So first, I thought I would share those with you all. In the state of New Mexico, we now have 174,064 positive cases of coronavirus. There were 2,367 new cases reported over Friday, Saturday, and Sunday this past weekend. And as of Sunday night, there were now 479 hospitalized patients throughout the entire state who are positive with COVID-19. At RGH, as of yesterday, we only had one positive COVID patient. So that's been fluctuating here at RGH, anywhere from 4 to 5 positive COVID patients, and we've seen a decline over the past 2 weeks. I'm really pleased to say that. Also, about the hospitalized patients throughout New Mexico, I mentioned there were 479 throughout the state as of Sunday night. At our lowest level last summer, that got down to around 70 hospitalized patients statewide. At our peak several weeks ago, it got back up to around 1,200. So the fact that it's coming down to 479 again is a real positive, I think, sign for our state. We have had a total of 3,283 deaths in our state associated with COVID-19. And I say associated because, again, most of those patients also had underlying health conditions. And nationwide, we're not seeing a big increase in the number of routine deaths month to month, although what we are seeing is now they're associated with COVID-19. So I just wanted to share that with you all. So here locally in Roosevelt County, we had 13 cases reported over Friday, Saturday, and Sunday. And again, that's significantly lower than what we had been seeing about 2 weeks ago. We've had a total of 1,763 positive cases in Roosevelt County. And of those, 1,099 people have made a full recovery so far. We have had 45 deaths associated with COVID-19 in Roosevelt County to date. Now, the the governor has established gating criteria. I'm sure you're all aware of that in order to reopen our state and our county. So the criteria is that we should have 8 cases per 100,000 people of coronavirus on an average basis. And right now, our current rate is the equivalent of 32.7 cases per 100,000 people. But we are seeing that number come back down, although we're not down to 8 yet. The other gating criteria that she's established is a test positivity rate. And our current rate in Roosevelt County for the most recent criteria is 8.46% of tests are positive for COVID-19. And the target for that is 5% or less. Now, I will also tell you that I question the absolute accuracy of some of that data just based on how we're supposed to report at Roosevelt General Hospital. And when we started antigen testing in our COVID clinic, we weren't even required to report that number to the state. So if we had a low test positivity rate there, it wasn't even being included. It now is, but I just put that out there to say that the data is not 100% accurate. I know the state is doing the best they can, and we're complying with all the reporting requirements, but that's what we're seeing right now. So I did want to share with you the vaccine. RGH signed up to be a vaccine site very early on, and we were approved by the state. So every week we request a certain number of doses of vaccine that we believe we can administer to citizens here without wasting any vaccine. That's really our goal. And we're getting 6 doses out of every vial. And we're exclusively, as of right now, getting the Pfizer vaccine, not the Moderna vaccine. So the Pfizer is the one with the greatest efficacy. It protects you at 95% against COVID-19. So far, we've vaccinated the 1A phase established by our state, which are the healthcare workers and people at greatest risk. We're now vaccinating 1B, which is anyone 75 years or older, as well as anyone 16 years or older with underlying medical conditions that puts them at a higher risk, and frontline workers who are unable to work remotely. We did start vaccinating teachers because we felt like they fell into that category. And just the past week or so, we've gotten some new information from the state that we need to stop that because they're looking at perhaps a vaccine shortage now and into the future. But what I will tell you at RGH is our goal is to fill all of our appointment slots, and we're vaccinating about 100 patients every day, Monday through Friday. And we are filling all of our slots. So if we have cancellations, we're being liberal with our interpretation of phase 1B just to make sure that we don't waste any of that vaccine. And I just want to put it out there, if any of you feel like you need to get the vaccine and you've not gotten a response from the state, we are using the state's website to register exclusively. We've pre-populated our schedule for RGH on that website. So you can go in and pick your own appointment once you get the notification and a code. But if you're having trouble doing that, please contact me or my assistant, Debbie Lamberth. We are happy to help anyone navigate that registration site and get you on our schedule if you need to get the vaccine. So far, as of last Friday, we have vaccinated we've issued 928 vaccines. We've done all of our second round doses from our healthcare workers that were in the phase 1A. So that's all done. And I also wanted to say I'm up here not wearing a mask, even though I'm socially distanced. I've had both of my vaccines, so I feel pretty confident that I'm keeping people safe now, although I still continue to mask when I go out in public. So I just wanted to put that out there. But we've given 928 doses. Again, we're doing about 100 a day, Monday through Friday. And I think we've streamlined our process at RGH. We've actually gotten some compliments from patients that it went well. You come in, you register, we find you, you go in, you get your vaccine. We take you back out to the lobby or a conference room, depending on the day and how many people we've got. And then we monitor you for between 15 and 30 minutes, depending on if you've had a reaction to a vaccine in the past. So I think we're getting people in and out, and it's going pretty smoothly. Do y'all have any questions about the vaccine process yet? Okay. I did want to share with you some of the therapies that we're using at RGH. Some folks think because we're a small rural hospital that we're not on the forefront of these therapies, and that is absolutely not the case. Just anecdotally, my mother is a nurse who lives in the Dallas area, and they can't get some of these therapies there. And when I tell her what we're doing at RGH, she couldn't be prouder for a small independent hospital that we're on the forefront of this. And we've just got a great team. It's not me, it's the team at RGH who just wants to make sure that we're providing the therapies that we know are working, and they're changing every week, and we're staying on top of it. So I wanted to share with you some of what we've done in terms of the therapies. So remdesivir was really the first FDA recommended drug that lessens the symptoms of COVID-19, and it is for hospitalized patients. It's for severely ill patients. So we've given remdesivir out of our ER and our inpatient unit to 58 patients so far, and most of them have done very well. BAM, now that's an abbreviation because I can't pronounce the long name of the drug. I will try. Only my pharmacist and chief of staff have been successful in this so far. So the drug is bamlanivimab. So it's called BAM. And we have administered BAM. It's an infusion to 64 patients. And the purpose of BAM is to give to patients with mild to moderate COVID symptoms that may have underlying health conditions and we fear may become hospitalized. So the purpose of BAM is to keep those patients out of the hospital. And we've been very successful. We've seen a lot of patients make a quick recovery after we've given them the BAM infusion. So to date, we've administered BAM to 64 patients. And again, if you know of someone who contracts coronavirus and they have the potential because of underlying health conditions to get really ill, please make them aware of BAM, make their provider aware of BAM. I think we've educated all of our providers, but that has been really effective in keeping folks out of the hospital and not acutely ill so far. And then lastly, Regeneron was the latest product that we've received, and it's very similar to BAM in terms of it's a monoclonal antibody, which in essence attacks the protein spikes around the coronavirus, and that blocks it from entering a human cell, is what both BAM and Regeneron do, as opposed to remdesivir, which actually stops the replication of the virus in your system. So we've administered Regeneron to 25 patients so far. I think that is it for kind of the COVID update. Again, in general, we're seeing a decrease. I think masking, getting past the holidays, as well as the vaccines has really contributed to the decrease. And I just hope we're on the downhill side of this, knock on wood. Any questions for me about COVID that I might be able to answer from a local perspective?
I have a question, Madam Chairman. On your testing rates to get us back into operating yellow to green, of our tests we give, how many of these tests are actual citizens of Roosevelt County and not somebody that just come in that makes our numbers look higher?
You know,
these are questions I've been asked.
Yeah, sure. I don't have an answer to that, Shane. I think the majority, and I would say probably 95% of what we're seeing at RGH are local people that are citizens of Roosevelt County, but I can't speak to the health department. And I do know that they've had folks from other counties come in. So I can only speak for RGH about that. And the vast majority of those are people who live here. Would you like me to cover any testing That's one thing I didn't mention. So we've got several mechanisms of testing right now at RGH. The first, if you come through our COVID clinic or our ER and you've got symptoms, we will typically give you an antigen test. That is only good for symptomatic patients. It may give you a false negative if you're not symptomatic. The next test that we have in-house, that's an in-house test. The next one is our BioFire, and that is a molecular testing piece of equipment. So it actually tests essentially the DNA or RNA of whatever you've got going on, whether it's a bacteria or a virus, and it will tell us specifically what that virus or bacteria is within about 45 minutes. That is for both people with symptoms and without symptoms, and it's 99% accurate. So the BioFire is something that we typically use if someone thinks they may have been exposed and is at high risk for exposing others, but they're not exhibiting symptoms yet. And then we're also sending out tests to LabCorp instead of the state. That changed about a month ago. The state lab is no longer accepting tests. And these are PCR tests also with a high degree of accuracy. So we've sent 377 tests to LabCorp so far. We've received 306 negative results and 57 positive results. For our Abbott rapid testing, that's the other rapid capability that we have, and it's a machine we actually received from the state early on. It is also only for symptomatic patients, just like the antigen testing is. We've tested 472 people so far, 388 negative results, and 83 positive results. With our BioFire molecular equipment, we've tested 623. We received 463 negative results and 160 positive results to date. And then lastly, with antigen testing, we've tested a total of 2,010 patients so far, typically through our COVID clinic. We've received 1,375 negative results and 635 positive results to date. So that's what testing has looked like at RGH. Like I said, we also have our COVID clinic, and we separated that to keep people well from our regular RGH clinic and keep people that have any type of COVID or flu-like symptoms, keep them separate. And that was actually some feedback that we got from our patients. So we made that physical separation with a new entrance to the RGH clinic and a separate waiting area for the COVID clinic and separate treatment area that's lined with glass to keep it safe from the rest of the clinic. So that took place, I want to say in mid-October is when we made that change. And our goal was to try to do it before the weather turned bad because we had our COVID clinic outdoors prior to that. So that has happened. We are also very fortunate in that we received CARES funding due to COVID back in June. We received actually a couple of different distributions of it, and that totaled about $9 million. So we had to spend that money on COVID-related activities, or we give it back, and we are not giving that money back to the federal government if we can help it. So the first thing that we did is made plans to build an actual separate but connected COVID/infectious disease clinic onto our existing RGH clinic. So that construction is in process now. It should be completed by June, which was the target. And so we're pretty excited about that. We've designed it to be multi-purpose. So once we get past this pandemic, again, knock on wood, we'll be able to use that for perhaps things like specialty care. So we've got some longer term initiatives in our strategic plan to bring in more specialty care to RGH. So next, I did want to share with you a few other things that are happening at the hospital that we're really excited about. First is our new emergency department. So I toured it last week. Sheetrock was up, some of the texture was up, and it's absolutely beautiful. We're going from a 6-bed with lack of privacy, ER, to an 11-bed with fully private patient rooms, including a behavioral health safe room, a bariatric room for larger patients, and an isolation room for things like infectious diseases. We also have the capability of creating more isolation rooms with portable HVAC units if we need to do, which is what we've done through this pandemic. So we're still on target, I'm pleased to say, for a March completion and transition into that new emergency room. So we're very excited about that. Our existing emergency room space, we solicited proposals from all of our staff. We looked at what the need was in the community. And what we ultimately decided to do with that space is enhance our cardiopulmonary department and create a 2-bed sleep lab. Because right now, folks have to go to Clovis if they need a sleep study. So we're gonna offer that service at RGH once we get into the new ER. We'll have to do a little minor renovation to the existing ER space, but we think that's the best use of that space and a best offering for our community right now. We also have plans. We're using some CARES funding to create what we're calling non-clinical space to decompress the hospital. So that's going to be behind the new COVID clinic that we're building. And we're going to move our business office over there and our medical records office over there and a couple of other functions. And the purpose is really to create some more space within the hospital proper so we can continue to add specialty care there. We're considering a Medicare Wellness Center in what is our existing business office once they're able to move over there. And again, we're using CARES funding to do this because our existing business office, they're on top of each other in cubicles, and there's no way to prevent infection there. So we've run this by the auditors, and they believe that that is sufficient justification to use our CARES funding for that building as well. So total between the COVID clinic and the new non-clinical space, that's just under a $3 million project. And by doing them at the same time together, we can save $140,000. So we took that to our board and they approved that at the last board meeting of our trustees. So again, the purpose is to decompress our main hospital so we can bring more clinical services into the main hospital. The next project that we'll be looking at, let me back up. I also think I may be able to pay off our existing emergency department construction, which was about $4.2 million, which we financed through the New Mexico Finance Authority. I believe, according to the auditors, that I can use CARES funding to pay that off for the simple reason that we couldn't prevent infection in that old emergency room when you had 3 bays that were just separated by curtains, not even real walls. So I've been given the green light on that. Once we're able to pay that off, our next big project is going to be to expand our ORs, our operating room, and our surgery. We've got surgeons that would like to come and do surgery at RGH, but we just don't have the space right now. So I think that will really benefit the folks who live here. The 2 specialties we will likely go after first are cardiology, because that's our greatest referral, and our second is orthopedic surgery. And I would love to bring orthopedic surgery to RGH once we have a bigger or expanded surgical suite. So those are the big plans right now in terms of construction. And then the one other thing that I really wanted to share with you all that we're so excited about at the hospital is we're changing to a new electronic health record. So right now, we have one electronic health record called Allscripts if you come to the RGH clinic. But if you do anything on the hospital side, we have a separate electronic health record called Paragon. And the 2 don't talk to each other, which means if you are in clinic for something today and you get worse in 2 days and come to the ER, our ER doc can't go into the clinic electronic health record and see what you are seen for. So this is going to be one electronic health record that can be viewed by all the clinicians, whether you're in the hospital or the ER or the clinic. And how it's really going to benefit our patients is it's going to streamline the registration process. Right now, if you come into clinic and your doctor or provider orders a lab or an x-ray, you have to come back out and re-register in the Paragon system. And that adds about 20 minutes to your visit. Once we move to this new single electronic health record, and it's called Meditech, by the way, you won't have to come back out and re-register. So it's really going to streamline that process. And that's probably the current biggest complaint that we get, is just having to come back out and re-register because our patients don't understand it. And frankly, it doesn't make any sense. So we have been working on moving to a new electronic health record for a year. We put together a multidisciplinary team to evaluate about the top 6 electronic health records in healthcare. And we went and we toured different facilities who had different records in use. We talked to people, we had demos come in, and ultimately this team recommended Meditech. And Meditech is pretty much the Cadillac of electronic health records for small to mid-sized hospitals. So it offers a lot of benefits. We're actually going to be able to save money once we make this conversion in terms of our IT costs. And we've been building this electronic health record for months now. We went through an extensive test of all the different modules 2 weeks ago. And so we're on the cusp of going live, and our target date is March 1st to convert. So it might be a little rocky the first couple of weeks that we make the conversion. So please hang in there with us, but it's going to be so much better once we get it up and fully running. So those are the big initiatives that are going on at RGH right now. We've got a lot of stuff going on top of COVID, but we've got a great team. I couldn't be more blessed to have the team that I work with every day because they're dedicated in moving RGH forward and just providing the very best service we can for this community. So that's it for my update. Do you all have any questions?
Question.
Yes, ma'am.
On your Meditech system, will that go ahead and automatically upload all the clinic and hospital that are separate now? Will it combine them and put all the previous stuff on that system? Or will
No.
it start fresh?
No, it doesn't combine everything. It combines what they have determined to be the most vital records. So labs and x-rays should be available, but maybe a progress note from a clinic visit 2 years ago may not be available in Meditech. But we do have the ability to go back into the legacy system, and we'll have that for at least 3 years. Yeah, but it does pull in what they've considered to be the most vital information from all of the records into Meditech. That's a good question.
Anybody have anything?
Thank you, Mrs. Green, for your report. It's very professionally done. I appreciate that.
Thank you, sir.
Sounds like your hospital is in good hands. I have a couple of questions. One, to follow up on Commissioner Lee's question on how is our numbers in this county impacted by people out of county? To move that up a notch, do you have any information like in our state? How is the numbers in our state being affected by cases coming in from outside of the state, especially like the Native Americans out of Arizona? How is that impacting our numbers? So keep that in mind.
Okay.
Another question: when we start talking about the number of cases deaths due to COVID, we're talking about the term associated with, which that's kind of an ambiguous term to me. I don't understand what associated with. Perhaps you might be able to maybe elaborate a little bit about the term associated with in contrast
Sure.
to directly
Sure.
responsible for.
Sure. Well, and that's very nebulous in general. So what I'm going to tell you is my personal opinion right now. So please take that for what it is. In my thinking, if you get COVID and you develop COVID pneumonia, which is a different pneumonia than a regular pneumonia, it looks different on an X-ray, and you don't recover from that, to me, that's more of a direct COVID-related death. But if you come in with a lot of comorbidities, which means a lot of underlying illnesses, if you're already on maybe verging in liver failure or kidney failure, or if you've got cardiac issues and you get COVID, COVID is harder on all of your organs, not just your lungs. But what we don't know, if you don't survive under that circumstance, is we don't know if you would have survived otherwise, if that makes sense. And there's really, at this point, no way to determine that. Does that, I know I didn't fully answer your question, but that's about the best answer I've got right now.
No, it doesn't, because what I want to know is
Okay.
if we could access data that shows how many cases there are that are directly, the death that is directly
Yeah.
caused by COVID. Is it-
My answer is no. I know a lot of people, especially throughout our state, have asked that same question, and it's just not being tracked that way. When we report a COVID death, they don't really. I mean, they ask us if there are underlying health conditions, but there's no true determination made at that point as to whether that was directly a result of COVID or not.
Could you qualify the they?
Who we report to the state.
Do you have any opinion as to why they're not considering that as a factor?
I don't. I can't offer you any opinion, and maybe because it's not even something a clinician would always feel comfortable trying to make that determination. And really, an attending physician is the one who would do that. And then you've got the other end of the spectrum, I'll tell you, where you seem to have a very healthy person, perhaps in their 30s or 40s, and they get COVID, and then it attacks their organs, and they don't recover, and we don't know why. We don't know why it attacks some people more vigorously than it does others.
Thank you. What about Commissioner Lee's question about out of state?
I'm just going to give you, I don't have any data. I do sit in on weekly calls with the state. And so I know that there was a time where people were coming in from Arizona into the Albuquerque area for treatment. It did not last very long. So my personal opinion, and again, this is just anecdotal from what I've heard from these weekly state calls, is that those folks have probably not significantly impacted our COVID numbers in New Mexico. But that is my personal opinion. I don't have data, and I've not seen any data to support that. I will also say, likewise, we have actually sent patients to Arizona, even out of RGH, when we could not find a bed for them, a higher level of care within the state of New Mexico or in West Texas. I know of 3 specific patients who we did send to a hospital in Arizona. So not near as many as what I think Arizona sent to us at one point in time, but it does go both ways.
Commissioner Savage, I want to add too, so in our regular conversations with the emergency management and Department of Health, what they're telling us is that when they come in, even if we have people drive down from Clovis, say when the Clovis Public Health Office was closed, you have to pre-register for the testing. So they go off of the physical address that you put in at the time you register. So even those people that are coming out of county to test here, or ours that are going out of county to test at Clovis or something along those lines, or some of our residents may have gone to the Roden Smith event when they were doing all the vaccines, those are being shared through the system, is what we're being told by the Department of Health. Now, the issue that they're having is more of crossing the state line. So when our patients are over in Texas and they're testing positive with their providers over in Texas, that information is taking a while to get into our system. And they're also having concerns with how to get the vaccine in. And I'm sure y'all are hearing about that too. We're just hearing that if they go to Texas and they're getting the vaccine, they need to come back and report that themselves basically to the Department of Health to guarantee that that information is being put into the system, because Texas and New Mexico are not talking as well.
Right. That's absolutely right.
Thank you.
And I also wanted to share our hospital at RGH has never been overrun with COVID patients. I think the most that we had at any point in time was 7. You know, we're essentially a 20-bed hospital. So we did not see the taxing on our system like most of the other hospitals did throughout New Mexico. That's a good thing. But how it did impact us is there for a couple of months, we had a really hard time if we had a patient who came in the ER or maybe started getting worse and needed ventilator care. We had a hard time getting those patients transferred. I think it took us 12 hours one day to find an accepting hospital to move a patient. And so that's how it really impacted us, is that we couldn't find a free bed in West Texas or New Mexico there for several days. So so the impact on us is we were gearing up to essentially create an ICU within the confines of our emergency room, because we don't typically have an ICU on our med-surg floor, although that is one of our goals for the next year, is to bring that back.
I have a question, Madam Chairman. And this, Ms. Hamilton and Ms. Green might be able to answer. So if we have a resident that goes to Texas that's older and they catch COVID in Texas and then they go to a nursing home, they don't come back to the county, are they still considered on our list as COVID patients for Roosevelt County? Because that's something, we're just trying to get back to the yellow, the green, to get our schools back open, our businesses back
Right.
open. And I'm just trying to figure out some way that we can track, if that's what we're going to do, who in Roosevelt County has it, and where should we focus our safety at?
So what we're being told is, yes, it still goes back to the physical address of their residence. So if they live in Causey, but they're in Lubbock seeking care, and then they go to a rehab, they're still attributed eventually to Roosevelt County in New Mexico. The problem with the numbers and tracking it, we tried to develop a spreadsheet and track it based on the daily numbers. But per Dr. Scrace, that is not viable, because when they report, like, yesterday we had 3, I believe. Those 3 are not attributed to February 1st. Those 3 are attributed to the actual day the test was collected. So there is no way for us to track locally where we're trending. We see that our numbers are down, but we can't accurately calculate where we're really at in terms of our gating criteria, because we do not have that data. They're not sharing that with us of the actual test collection dates. Instead, we just see a daily number that could have been up to 7 days ago in the collection process. So there's very little locally we've been able to really track with accurate data. The data is very difficult to mine, and they're not sharing that type of information with us locally.
And I echo that. When the gating criteria was first established months ago, we tried at RGH to replicate the data, and we got close. We got close, but we never could come down to the exact numbers that the state was providing. And it's for the reason that Amber shared, because the dates don't match up. It could be 7 days previously in a different state, and we wouldn't have that information locally. So we've tried to replicate the data too, and just can't do it.
So about how long is it taking the tests to get back?
Well, from LabCorp, it takes 2 days. They've got a very quick turnaround time compared to what the state had been doing, because the state had been up to 6 to 10 days when they got really backlogged. So LabCorp, we're seeing 2-day turnaround time. Antigen testing is immediate at RGH. BioFire testing is 45 minutes in-house at RGH. The Abbott Rapid is a 20-minute turnaround time in-house at RGH.
Okay. And what about what we're doing like at the detention center and stuff?
7 days.
7?
7 days on average from the Department of Health.
So if we say we have 2 on February 1st, when we get those back, say we have 2, actually, those could have been from, so we really don't know. So we're 2 weeks out of knowing whether we're going to be red, green, whatever.
And we're having to rely on the state for that information. There is no way to compute that locally.
Correct.
Do
And
we
I
know if
will
we-
also share that with our antigen testing, which is what we're doing in our COVID clinic, primarily for symptomatic patients, we're required to report daily on all positives, but we're only required to report once a week on the negatives, which makes
Oh,
no sense to
convenient.
me.
Yeah. So, do we have any record of how many like false positives we've gotten or false negatives that we've gotten?
At RGH, we do. Yeah. Yeah. And it's been very few. I want to say with our Abbott Rapid, we've received, I think, 3 false negatives. And we had 4 rejected from our Abbott. With antigen testing, we've had 6 false negatives out of 2,000 tests to date. So it's been very few. And honestly, I think a lot of that has to do with how you're swabbing. The more it hurts, the more accurate it's going to be. And our staff at RGH are determined to get an accurate swab. So I think the falses that we've gotten back perhaps had more to do with the swabbing than with the equipment.
Thank you. Anybody else have anything?
I've got to point something out on the inconsistencies of this COVID-19, because initially, when it became rampant last March, April, May, what came to my attention from a lot of individuals was the numbers were so inconsistent, because so many individuals were ending up in Lubbock with either other conditions,
Right.
pre-existing conditions, or just getting sick and choosing to go to Lubbock.
Right.
And Roosevelt County residents that were being tested and diagnosed with COVID in Lubbock. And it was taking months for New Mexico to catch wind that those numbers were coming out of New Mexico, out of Roosevelt or Curry, or all the eastern part of our state that normally practices going to Texas for medical care,
Right.
like me.
Right.
But anyway, so I think since day one, there's been inconsistencies. So the questions that you guys are bringing up, Commissioner Lee, Commissioner Savage, is I don't think we're ever going to have any accuracy, in my opinion. That's just my opinion. So I thought I'd bring out that point.
I don't disagree with you at all. Not at all. And I do think Texas early on was very slow in reporting on New Mexico citizens. I think they've gotten better, but I agree with you. Early on, there was a long lag time for us to get the information back from Texas.
Result actually is that we could have been doing really well at that point, but the numbers are just now coming in. So what's really affecting us could have happened 2 or 3 weeks ago or a month ago or
Could have.
whatever would have been when we were actually doing poorly.
Could be, yes. Yes.
Anybody have anything else? Okay. Thank you so much. Kate. We
Okay.
Ma'am, I
appreciate
have
it.
one more question, and I know we're taking too long on this, but I'm curious about something. After attending the virtual conference, the New Mexico County Conference, there was a man named Mr. Hamilton, who was the head of the Homeland Security, gave a report. He was concerned about the number and the health status of the approaching caravan at the Mexican border. Do you anticipate any spillover from that, accepting those immigrants into this country? Could it affect our health care facilities? Are there any preparations and anticipation of the spillover?
I think it could have some impact on us. To what degree, I really don't know yet. That's a question I'm not really prepared to answer. But I will say we always do have some impact from immigrant patients without insurance who come to us for care, and that's just part of our system with indigent care as a fallback, with charity care. So we have some level of, I guess, protection from a financial standpoint. I don't see that our hospital is going to be overrun or anything like that, at least not here in Roosevelt County. So we may have some impact. I won't say we won't. I don't think it's going to be that significant here.
Thank you.
You're welcome, sir.
Thank you very much, Ms. Green. We appreciate it.
Thank you all. And we appreciate everything that you all do. Thank you.
Okay, moving on to public requests.
No, Patrick.
Oh, I'm sorry. Patrick, I'm just skipping over you. It's hiding.
It worked. It worked.
Thank you. I'm freezing.
Good morning, Commissioners. Thank you for hearing me. We thought it had been a day or two since we got in front of you guys, and we wanted to make sure we were out. The top page is just a summary of the last 6 months of things that we've had going on. The last 2 pages are upcoming programs that we've got put together. I'll be absolutely honest, we held out just a hair, hoping that some degree of normality would come back and we could go back to doing things as we traditionally do. As we've all noticed, that has not happened. So we are branching off into the Zoom world to do some Zoom programming. So in the next month, we've got some opportunities there. So if you're interested, take a look at that. Like I said, just wanted to hit on a few highlights of things that are going on. Ryan has continued to work on 4-H activities. As you guys know, 4-H is a very hands-on program, and so it's been a real challenge as to how to keep the kids engaged. As we hear the discussion quite often, they are zoomed out. I mean, they are mentally fried on keeping up with online activities. So we're working on that. We're cautiously optimistic as things will open up a little bit, that we can get back to some small group activities with proper spacing and COVID safe practices and such forth. But that we can allow the kids to get back. It's been quite amazing when they have the opportunity to get together. What it has done for their mental health and well-being is just being able to interact and spend time with contemporaries. We are getting ready to with our chick donation again. We've done that for several years now, and that's actually coming up tomorrow. We're anticipating another year. Most of the fairs are cautiously optimistic that we will get to participate with some type of stock show activities. On to the ag and home ec stuff. We've got a new secretary, and Mr. Lee knows her well. It's his nephew's wife. Like I said, she's been a wonderful addition, and she's really has fit in well. But we're reaching out to our extension ladies, doing some activities and programs with them. We've continued to do everything we can do to assist folks, making home visits, answering phone calls, seeking assistance from specialists on answering questions and problems. So it's like I've told a lot of folks, when you're in the people business and you can't directly work with people, it does impact what you can do a little bit, and it does require a little bit of creativity. And then on to our ICANN program. Again, Carol's is a very hands-on program when she works with folks and provides direct education to them. And so without being able to meet directly with her clientele, that's been a challenge, but she has embraced technology and is utilizing the Zoom and Facebook platform to teach classes. And like I say, it really is forced our hand, which has not been a bad thing. We've had almost 5,000 social media contacts in the last 6 months. So it really has opened an avenue to allow us to reach a wider clientele and a different audience maybe than we were before. So like I say, when you try to find the positives in this, like I say, it has forced all of us to embrace technology, whether we wanted to or not, and has allowed us, I think, a different avenue of outreach than we've used before. But anyway, I would stand for any questions. I don't mean to hold you guys up. I know you're busy, but like I say, as always, we're there, a phone call away to help you with whatever it may be that you need assistance with.
Thank you, and Patrick and all of you you and Ryan and everybody over there for keeping our kids engaged and giving them something to do. I mean, I know this time's been hard for everybody, but You guys have been great, and I've heard a lot of good things about y'all over there working with the kids and trying to find ways to work around the different obstacles you've had to face. So thank you very much.
Well, I appreciate that. And like I say, we, just being honest with you guys, the New Mexico State has been much more conservative in their approach about things. So it's been a wee bit of a challenge for us on how we approach things when our personal views may not quite line up with administrative views. So, but like I say, just know that we're here for you and we're happy to help with whatever we can.
Madam Chair, I got a question. Mr. Kurt, I see the Zoom webinar here for the weed update is got 2 hours of CEUs. If there's some of the older gentlemen that need to get their credit hours, can they come in somewhere to help?
Have them
watch
give me
that
a call.
Zoom?
Have them give me a call.
Okay. Because I know
we are happy to help, and we will.
most of them are used to just going to a meeting
Yep.
and sitting there and listening.
And that's what they would prefer. And I fully and completely recognize that. So, like I say, have them give me a call and we will work out a plan to make that happen.
I just want to get that out for maybe somebody heard it that's watching.
No, like I say, please give us a call and we are happy to assist you.
And that's on Thursday, February the 18th.
Yes, sir.
Thank you very much.
Thank you very much.
Now we'll move to public requests. Did we have any, Amber?
Oh, Madam Chair.
Okay, elected officials. Move on to Treasurer's Office, Ms. Sanchez.
Good morning, Madam Chair and Commissioners. So I was very excited that we had the open our doors yesterday and actually physically lay eyes and help hands on our constituents. It was a really good day. And my glasses are fogging. I'm going to have to take that off. Okay, so today I want to talk about your November 30th balances. Your beginning cash and general fund on November 30th was $2,811,923.01. You had debits of $2,064,778.40, and you had credits of $497,665.98, leaving your ending cash at $4,379,035.43. Does anyone have any questions for me? Short and sweet and to the point. Okay, thank you very much.
Mention, Mr. Porter.
Morning, Madam Chair and Commissioners. The facility count today is 61. We have 10 females and 51 males. Currently, we're housing 5 out-of-county detainees. The total number of bookings for January was 67. The total number of releases was 60. Some of the things we got going on in the facility right now, we have 1 officer going through our academy training. We are using some COVID-safe practices for our in-person training. A number of our trainings that have to happen for our staff annually for our accreditation have to happen in person, like our defensive tactics programs and things like that. So we're limiting the number of people in our classes, but we're also bringing them in only with their assigned shifts. So they're only around the people that they normally work with so that we don't cross up our shifts. So it's becoming a training obstacle that we're working through. And our training staff is working well to make sure that everybody's staying safe and everything's staying clean. We're still doing COVID safe practices throughout the facility. We are now offering our staff information on how they can acquire the vaccine through the community right now. And we are also providing that information to the detainees upon release, because we have been unable right now to work with the state to come up with an idea to provide that vaccine inside the facility. It's still progress and work. So we're just providing the information upon release so that they can take it and work through the community resources as well to try and get those vaccines if they're interested. The feedback from the detainees on our tablet system that we rolled out in November has been very positive. It's keeping them engaged and keeping their minds a little bit more occupied. And we're seeing a decrease in some of our disciplinary problems throughout the days and throughout the weeks, especially some of our minor ones. So that's been a real positive thing we're seeing from the detainees, and the staff have been appreciative. Our tracking and documentation system, the Guardian system, I'm getting good feedback from our officers too. We're mostly digital on all the tracking, showing all the rounds and documenting the engagements that they're having with the detainees. So those two systems that we recently rolled out have been very effective, and we're getting positive feedback on those. So looking forward to see where that takes us in the future. And with that, I will stand for any questions.
Thank you very much.
Thank you, ma'am.
Finance.
Good morning. So included in your packet is the second quarter financial recap report that we submitted to DFA. The recap report captures the county's funds and their respective balances as of December 31st. From the report, general fund has an adjusted balance of just over 10 million. In the grand total, including all of our other funds, we have an adjusted balance of just over 16 million. All funds are performing better than projected, with 50% of the year completed. Overall, we are 50% expended, which is slightly higher than the 50% target. We have had several higher cost projects paid in the second quarter. For example, one of those costs has been the kitchen equipment for the detention center. Also included in those expenditures is the 1 million transfer to road. We typically wait to transfer that later in the year, but with all funds performing well, we went ahead and completed it in the second quarter. That concludes what I have for the second quarter financial report. I'll stand for any questions.
Second quarter report is submitted to DFA. That was Lily. I'm sorry. My bad. Road, Ricky Bellato.
Good morning, Madam Chair, Commissioners. There we go. Well, we've been really busy lately. My guys are doing routine maintenance. We're blading, we're cleaning cattle guards. We're staying really busy. I've got a crew down south in that Sagamore Wind Farm. We're on South Roosevelt Road K, and we're building 2.5 miles there. The other crew I have just outside here. We received a phone call a couple of weeks ago. Some good news here from one of our vendors, Holly, and asked if we would like some HFE 100P. And then my first question is, how much? And he said, free. And I said, okay, yes. Didn't know what I was going to do with it. 80 tons, equivalent to about $40,000. And we put our heads together, and we didn't want to put them on the road because of the weather, cold. We didn't want traffic on it. So we decided to do this parking lot just west here of the fairgrounds. But the subgrade was not ready, so we had to do the subgrade, and we had to get some base course. So we reached out to White Rock Crushing, Robert Maldonado, and he donated 140 loads out there for us to fix that parking lot. In fact, they're out there right now. We're fixing to start shooting here in just a little bit, and we'll chip seal it. We had the aggregate from years and years of just collecting a little bit here and there, so we had enough aggregate to cover it. So county is out, just equipment and labor is all we're out, and we're going to get both sides of that parking lot fixed. So good news there. I stand for any questions other than that.
Are you fixing that parking lot? You're expecting a big rain this summer, so it won't get muddy at the fair?
Yes, sir. And we're trying to feed it all to the grass.
Oh, good.
Yes, sir. Not here on the fairgrounds. So any questions? I'm here for that.
Okay. All right. Thank you, Ricky.
Thank y'all. I'd love to stay, but I gotta go, guys.
Miss Hamilton.
Yes, good morning, Madam Chair, Commissioner. So I will try to make quick work of my report here. Just some things that I want to go over. We are going to need to look at canceling our February 16th meeting and scheduling it to either Friday, February 19th in the afternoon, or Monday, February 22nd. We need a quorum. We will need to canvass the school, the special school elections that the clerk's office is handling. And those are specific to timelines for the Board of Canvas. So if you can please look at your calendars, either Friday the 19th afternoon or Monday the 22nd. If we need to follow up with you on that later, if you don't have your calendars with us, again, we need a quorum, canvas, special meeting. There may be a few other items depending on the legislature and the actions and everything. So I can follow up with y'all after this meeting just to see, since Commissioner Lopez had to leave early. Okay, the next thing is a quick insurance update. So we do have the courthouse roof completely done and repaired, and we have had that inspected, and that is now back under good condition of warranty. So we're good there. Magistrate Court has been done, and Road Department, as we've discussed in earlier meetings. We are looking at the Special Events Center, and I'm sure you noticed that they were working on that this morning. They're working to try to get that finished up. They will come back, and they have some gutter work to do at the Jake Lopez Center, the DA's office, the Los Abuelitos Senior Center, the Extension office, and what they're finishing over at the Special Events Center. At the Detention Center, we're more than 50% done. At this point, we have the TPO roofing and the back addition. We're working on the front addition where the gravel is up at the top. And then we also have the public health building that is in process. As far as vehicles go, we have one vehicle for the sheriff's office that is still to be repaired, and it was the most significantly damaged in their new transport van. So it's a very in-depth process to get that repair, but that should be this month. And then we have 3 trailers that were enclosed that are to be determined. And then we do have the next phase will be a variety of other buildings out here at the fairgrounds once we get the extension and the district attorney's senior center, special events, and Jake Lopez completed. Then we will have the pavilion. We have the little gazebo that has some work, the skylights on both the Quonset barns. They go around at that point, and the show arena, you name it, every building has something. So we'll be touching on those, but we wanted to get the ones that are occupied and most utilized first. So we're just trying to work through the priorities, and Mr. Spinks has been great at helping me with that. I'm sure you likely had seen the article in the Eastern New Mexico News. It highlighted that we had 38 businesses in Roosevelt County that received CARES money from the state. And that's in conjunction with those, we had our own separate program, so that's in addition. So it's really great to see all of these local businesses able to tap into some of those CARES monies and everything. So really encouraging on that. If you didn't see it, I'm happy to send that on to y'all so you can see the list. I will forward that out later. The part that is not as warm and fuzzy, obviously, is the jobless rate. So in New Mexico, we have seen in December, the jobless rate went up a full percentage point to 8.2%. That's based on, again, U.S. Bureau of Labor Statistics. According to the data, only 4 states posted higher unemployment percentages than New Mexico. The increased round of really strict, obviously, restrictions on these businesses and everything has just really had a very negative impact, as we're all aware, on our state economy as well as that locally. We do have a bid out for the used tractor for the road. We're looking at closing that out and bringing a recommendation to the commission. I believe that bid is actually due February 9th, next Tuesday. We do have a bid out for the new roof at the health center. And that is a combination of capital outlay funding as well as the roof damage recoveries from the insurance. So we have an on-site pre-bid meeting this Thursday to go over with any prospective bidders that are interested in seeing that facility. So we're working through those. The other capital outlay that we've been working on is the HVAC. We received a $60,000 allocation for the courthouse and the enterprise units. The courthouse units have been replaced. The enterprise units are in process and they're almost done. That hopefully will be finished this week. So we'll have both of those taken care of. And the great news is that was done in conjunction with the roof repair. So everything went seamlessly at both the courthouse and the enterprise center's roof repair will now come after the installation of the new HVAC unit. So we really are glad about that timing as well. We have been very actively involved with the Portales Income Support Division office in terms of some efforts to try to keep something here locally. We received notification that the state had an exposure in July, shut the office, and has failed to reopen that office since July. So we know that our residents are not able to get those direct services that they need. They've been redirected to Clovis, but as we all know, there are some transportation issues and barriers that our residents aren't able to achieve that. So we have communicated that with the state. United Way has been very active, as well as the emergency management team for the city and county, and a group of others from the Roosevelt County Health Council. And they've been gathering data. United Way put together a survey so that we could actually have some surveys results from our area. They are saying that they will have a town hall in our area. We have just asked for creative solutions, even if it's not full office staffing Monday through Friday, 8 to 5. You know, perhaps it's Monday, Wednesday, Friday, or Tuesday, Thursday, or mornings or afternoons, just to work in conjunction. Because again, we want to ensure that our residents have access to those services. When you look at our county, we are over 50% low to moderate income, and we have approximately 50% of our residents that are living with some sort of aid from the state, whether it's through Medicare, TANF program, anything along those lines. So we have a significant population of use in this area. The last thing to really report is we are exploring, the city approached us a couple years ago and wanted us to take over the compliance monitoring of the DWI piece, and they were going to continue to provide the DWI program. Since that time, as myself and the city manager again are talking through the initial phases of what the new governmental agreement between the city and the county can look like. This was one of those things that the city brought to the county and said, we really need to relocate this. Statutorily, the county's responsible for providing it. The city's not at the point where they want to continue to provide the service. So in working closely with what that's going to look like, we do have our new compliance officer in place. So at this point, it makes time if we're going to make that transition, because we brought compliance in-house. I feel like we can look at creative ways. This is grant funded, so they will be the grant funded soft employees in our personnel ordinance. It's all about making sure that we continue to receive that grant funding for these positions. But we are just in the initial conversations of having that discussion. The interesting thing, of course, is that the grant is going to be due to the state in March. So this is a very quick turnaround. We have some initial meetings this week with the DWI program coordinator that's currently in the spot of Ms. Reed. And she has been very willing to help with the transition of what everything looks like. We know that we will likely have at least one position that we'll need to post after this transition of what it looks like, but we're still in the initial phases of what this program can look like for our county, from a county aspect rather than the city, especially with the changes that we've seen in the schools, because they were very active in the public schools when we did have school and they could get in with teen court and things like that, but that has all been strictly limited, obviously. So a whole new program development, we're gonna look at what that can be, but want you to be aware, because there will be a point where we're having to apply for grants. Y'all will start seeing some grant agreements. We'll keep you posted on what that's going to be. We're really relying on Dana Hernandez. She's our compliance court officer to really help with this program development. And then, of course, Mr. Porter and myself are there to give the support, because she has a direct report of him. And so we're just going to work together and make this work for our county. So Now, switching gears to all of the legislative funness that we are seeing. It is beyond extremely challenging, as we all know, because public access has been limited regardless of what they want to say. It is just not the same. And it has been an increased burden. I will tell you, yesterday alone, the Senate was in session just to read bills, and they introduced over 160 new bills in the Senate. And there were 215 last night that I reviewed on NMLR, just quickly going through combination of House and Senate of what we were looking at. Many of those aren't even uploaded yet to the system because they're just hitting so, used to when it was a normal time and when we could actually participate, you might see 30 or 40 bills come in. It might be a busy day. You might see a few more than that, but it's a little more palatable. You could work through that rather than just having an enormous amount. We know that there was a massive crime reform bill. Senate bill, I believe it's 277, was dumped last night by Senator Linda Lopez from the Bernalillo area. So there's some of those that we know are going to be coming that we haven't even had a chance to really analyze and look at. We're just seeing the initial things of what has been presented. But I am working on that. We have a list that New Mexico Counties puts together of all the bills that are monitored. And then I have a refined list that we look at, and I shared those with you. We will continue to share. I have reached out to our elected officials and department heads to ask if their affiliates or areas are monitoring anything. We just want to make sure that we have everyone accounted for in our list of what we're monitoring, because there's times that there may be something elections based, which there were several that hit. So, yes. So there's going to be some more bills that we want to pick up for the clerk and that we're going to closely monitor and things along those lines. So we'll continue to work through that. We have been very active on House Bill 4, as you're aware, and we have another resolution that we'll touch on a little bit later, and I will go into further detail at that point to share on that one. I know that the chamber has been watching House Bill 50. That's the private right of action to enforce environmental quality. That could be very chilling, obviously, to our business industry, especially in agriculture and oil and gas. That is just a highlight, just the ability to bring some type of lawsuit on environmental concerns in that area. And so there's more to come on that one. We're watching it closely because we know agriculture is the driver in this economy here in Roosevelt County. And then there's several other ones that we're beginning to monitor. There was a House Joint Resolution introduced by Senator Purtle, allowing for 3 or more continuous states to split off and form their own state or join a neighboring state. And while that may not go anywhere, it is interesting to see the debate that sparks, especially on the eastern side of the state, which he cited in his article in the Journal about there's just a disconnect between the rural and the urban. And that Rio Grande corridor really just doesn't seem to have a grasp of what happens on the eastern side of the state, or probably even the western for that side. It's really hard to have those conversations. And of course, it's interesting when you read those stories, and I think Senator Mimi Stewart's comment was, well, it's not that far. If people want to live in Texas, they can pack their bags and move. And that's really a shame because that's not the environment that we should be seeing from our political leaders. I really feel like, Senator Stewart should have a better idea of what's going on. We may not be her direct constituents, but we're still part of this great state. So it's interesting because the polarizing hasn't stopped, and it's at all aspects of all of that. But we will continue to monitor the bills very closely. New Mexico Counties has come out with their executive board list of what they've supported, and that was sent to y'all as well. I know we're going to be talking about this one a little bit later with Mr. Boone, but House Bill 33 with the livestock board meat inspections, they are in support of it. House Bill 49 and Senate Bill 78, which are the two together. A lot of times they'll introduce in both chambers to see which one they can move the quickest, but that's to exempt Social Security from the income tax. House Bill 55 for publication of capital outlay allocations publicly, a little more sunshine and transparency. They have supported that. House Bill 57 for Prescribed Burning Act. The Executive Council has voted to support. There's House Bill 92, Safe Drinking Water Fee and Fund. House Bill 103, Utility Operator Certification Act testing fees. House Bill 105, and also Senate Bill 72 again with the electric generation project requirements. The board is voted to support. House Bill 173, eliminating property assessment on residential solar. I think this was one that the treasurers brought forth, that the treasurers are really not wanting to be the debt collectors and really want to be careful in this area. And so they did support that one. Senate Bill 39, disclosure of finalist names. This was Senator Tallman's bill. The board has supported that, or the executive council has voted to support that at this time. And then Senate Bill 49 and 91, the use of local economic development funding. It's going to be a little more applicable, obviously, to the city because they're the ones with the LEDA fund, but they did vote to support that. And Senate Bill 64, federally insured obligations. They voted to oppose New Mexico Civil Rights Act, the House Bill 4, House Bill 40, Private Detention Facility Moratorium Act, and House Bill 50, the Private Right of Action. They have voted to oppose each of those. And other than that, I will stand for any questions if I forgot anything. Thank you.
Are you all finished with everything now? Are you finished with everything now? Okay, perfect. Thank you. Commissioners, y'all have anything?
I didn't know if Miss Hamilton's done, but what about our audit accountability award?
Yes, that's the fun piece. So I did ask Ms. Rivera to stay as well as Ms. Sanchez is here. So this is very exciting. It's obviously a lot more fun when we get to be in Santa Fe and get to have this as presented by the state auditor. But they did a great job on Zoom. We were able to send in a little picture with the award and everything. This is the third time that we've received an award from the state auditor's office. This is for fiscal year 19. It's for the Mid-Size County Audit Achievement Award. And this is something that obviously finance and the treasurer administration, we all work very closely on. We have a phenomenal team. The treasurer's office does an exceptional job of collecting it. And obviously Lily does a great job of spending it. So between those two, they work together so well. But it's very exciting still to see, even though we weren't there to have it in person. So we wanted to acknowledge that. And this is another one that we will put up in our commission room so that when we hopefully get to return there sooner rather than later, we'll have that there.
Thank you very much.
Thank you.
And by the way, do you have any idea when we might be able to return there?
Not very soon, as you can tell, as an item of new business talking about renovations here. So no, ma'am.
Thank you.
Madam President, I'd like to make a brief comment.
Okay.
As a new commissioner, I had the opportunity to go down to the courthouse, and Mrs. Hamilton assisted me with some very beneficial lessons presented by New Mexico counties, and she was a lot of times while they were doing their virtual meeting, they're presenting all those lessons. A lot of times she was on that presenting a lesson or involved in it. And what it revealed to me was her expertise in dispatch and effectiveness that she exhibits as our county manager. I know she got this Flame Award, which was presented by the state auditor, which, by the way, his enthusiasm was one of the highlights of the convention. I know she got that award, but I think we need to recognize her for that award, but that's only one little small thing that she does as a county manager. And I think we're very fortunate to have her as an employee. I think she's, I haven't seen a lot of other county managers. I know like Bernalillo County manager has a lot of responsibility, but I would think that Mrs. Hamilton would be right up there amongst the elite in this state as being a county manager. And I'd like to commend her for a job very well done.
Thank you very much. Okay, moving on. Item 6, resolutions, ordinance, and proclamations. A, consideration of resolution 2021-09, supporting reinstatement of the state meat inspection program in New Mexico. That was something that came up before on the New Mexico Arizona coalition that I'm on. And so I've asked Mr. Boone if he would come and speak on behalf of this.
I'm gonna take that thing off if it's all right with y'all. I don't think I'd have any trouble being heard through it. It does get hard to talk after a bit, and my mouth's already pasty from having it on for the time I've had it on. So, but Madam Chair and members of the commission, everybody, I'm pleased to be here this morning. I'm pleased to be able to hopefully offer some insight into this issue that I believe is a very needed thing for our industry here in the state of New Mexico. I'm currently, I think, in the final year of my 12-year commitment on the executive board of New Mexico Cattle Growers. I don't get to retire because past presidents stay on the board of directors for life. So I'm going to be not on the executive board, but on the board. But I'm pleased to still be able to come and provide information, and I hope that I can provide what's needed for y'all to make the decision that you need to make where this is concerned. But the state meat inspection deal is that we're looking at is a reinstatement of something that has fallen by the wayside in the past. We feel at Cattle Growers that it's a very needed thing, and I do too. There's two versions of the bill. There's a Senate bill and there's a House bill. The House bill is 33, being carried by Representative Rebecca Dow from Alamogordo, and we feel that that is the one that we need to support and push, mainly because it states that the state meat inspection needs to reside with the Mexico Livestock Board, and it needs to be fully funded. And we believe that too. We believe that New Mexico Livestock Board is the place to be a home for the state inspection program. The state meat inspection program is really, really needed because we have had a backlog of meat inspection for several years now, really it's been kind of sliding downhill ever since the state inspection fell by the wayside a number of years ago. But when the COVID hit, there was all of a sudden, and I mean really all of a sudden, it came out of nowhere. There was a great demand for local beef, and people were just seeking it everywhere. It was hard to get through the big stores and through grocery stores. There was places where there wasn't any meat of any kind available. So there was people trying to find beef to eat, which wasn't that big a problem, but finding a place to get it processed was a problem. And going through the motions of doing it all, you have to have an inspection program. There's only 4 certified USDA inspection facilities here in the state of New Mexico. So it all of a sudden, literally, just produced a huge backlog of people trying to get food to eat, trying to get high quality, good meat to eat, and they weren't able to because they didn't have a facility that they could go to where it could be inspected and be a healthy product which they could take home to feed to their family. So we believe that it really is a necessary thing for that reason. And then putting this back in will allow New Mexico cattle producers, beef producers, it will allow them to be able to seek value added for their product. It's going to enable them to be able to have local markets, more local markets. going to be able to cut down on the overhead, which we really need to do. It's going to cut down freight costs. It's going to cut down all kinds of things to enable them to be able to sell more of their product locally. And we also hope that through this process of, if we can get this passed, we do hope that the regulatory environment is going to be maybe improved, where it's going to be more of a streamlined process to be able to get a facility built and with less red tape, and to be able to put them in as a viable outlet and a facility where people can get their meat inspected and processed. I would stand for any questions if I haven't covered anything, but New Mexico Cattle Growers strongly supports House Bill 33 and the efforts therefore, and we believe that the resolution that was passed by the Chaves County Commissioners is a very good model to look at. We believe that it covers the bases that we need to cover in order to provide support for this. It's being, I believe it was in committee yesterday. I believe it was heard in a committee yesterday, House Bill 33. I got a phone call or two about it, and I don't know how, I didn't end up hearing how it fared, but anyway, I do believe, and New Mexico Cattle Growers believes that this is a very viable thing that we need to push for and need to support. So.
Ask you on this, will it enable people to be able to sell directly to restaurants, or is it going to be like a farmer's market type deal? Or
Yeah, it should. I mean, it should be able to. I mean, if all that is addressed in the bill itself and in the process that they come up with, yeah, it should. It should be able to provide an outlet for even schools. You know, we talk. What is it? The SNAP program that provides produce and commodities and things. Surely it would fit into there. I'm not sure. I mean, I shouldn't say that, but I feel sure that it will enable them to be able to sell.
And what do you think the opposition to this is that you've seen?
Well, I think the main opposition always has been is the funding of it. It's always been one of those things like, oh, meat processing, oh, meat inspection. That's something we can do without. We need to provide this or this or this, you know. But it truly is an important thing to be able to provide safe, clean, good product for our public. And so I believe it's very, very important. I think it's something that we need to prioritize, that we need to push for. But I do think the opposition is mainly the funding of it. But I think if we could ever get it in there and get a niche and get that funding set up, and where we can just go back year after year, and I think it would be a good thing.
Mr. Boone, this applies to all species of livestock and
Yes, sir.
wildlife,
Yes, sir.
elk and pork.
Yes, sir. Anything that falls under the inspection of being processed, and I'm not even sure what the word I want, but yes, sir. Yeah, that's true. Whether it be club lambs or show pigs or show steers or whatever, you know, I think it will
I know
cover
that
everything.
currently our 4-H and FFA members with show projects, when you're done with the project, if you have a pig, how do you dispose of that pig? It's going to cost you $50 for a health certificate, which a veterinarian just walks out there and looks at the trailer and says, yeah, it looks like the right tag number, calls you $50. In addition to that, there'll be about a $10 or $11 a fee for inspection for livestock. So it costs you more to dispose of that animal than it probably is worth, you know.
Right.
So this would, to me, would allow our 4-H and FFA members an avenue to market their animals. If I could sell that animal to a neighbor or something and have him butchered and delivered to him, I think it would be a cost saving to them and inspire, you know, help them along career in an agricultural field.
Sure. You know, if you look back just over the last 20, 30 years, there used to be a lot more meat processing plants here in the state of New Mexico. There was a pretty good one in Tucumcari. There was a big one in Roswell. There was there was 2 or 3, maybe 4 here in Portales. There was 2 or 3 in Clovis. And as the inspection became a bigger and bigger item where the backup was getting, where they had to wait on an inspector, you know, I think a lot of them got to where they would only be there 1 day a week where they could inspect the carcasses that they had prepared up to that point. And I think that you're right. Yeah, it's going to provide a lot better outlet, or provide an outlet, not a better outlet. It's going to provide an outlet for, like what you said, the kids with their stock. And then there's also been a push among lots of smaller producers, particularly that are selling grass-fed beef. That has been a huge thing over the last few years. You know, people thinking that that's more in line of what they need to have, and so there's quite a few people that do that. I know several people that do it, and it's been a problem because there's problems not only getting it inspected but getting it processed. So I think this will be a good thing to prioritize and to push and to try to get back going.
Anybody else?
Does anybody else have? With that, I'd make a motion to accept resolution 2021-9 supporting the reinstatement of the state meat inspection program.
No. Got a motion and a second. Commissioner Savage? Pardon? How do you vote? Do you have a discussion? Okay. Yes.
Yes.
Motion carries. Thank you.
Well, we appreciate it. The beef producers of New Mexico appreciate it, and y'all don't hesitate to call if there's ever anything that New Mexico cattle growers can do for you. Some of you got my number. Most of you can find me pretty easy. So thank you for having me here. And I'm like Ricky. I hate to go, but I was following my favorite basketball team over the weekend, so I'm kind of behind on my hay feeding. So I got to get home and feed some hay after I go to Clovis. So go see the banker. So I've got to get around. Thank you.
Thank you very much.
Pat, we appreciate all you do at the cattle growers, supporting all of us rangers. We do appreciate it.
Thank you, Shane. Well, it's a labor of love. It really is, because it's an industry that I love, and I enjoy serving my fellow producers. So anytime. Y'all take care. Thank you.
Thank you. Okay, moving on. Consideration of resolution 2021-10 opposing House Bill 4. Ms. Hamilton.
Yes, Madam Chair, Commissioners. So as y'all recall, this past late summer, fall, the commission adopted a resolution opposing the recommendations of the Civil Rights Commission. This resolution takes it one step farther. Several counties, we actually have this on our agenda to, this is a template that throughout the state, we've taken it and made it unique to our own counties. But it is something that we've looked at further amplifying our voices. All of our representatives and our senator are well aware of the commission's stance of where this is. I shared the original resolution, but again, that united effort. At this time, I really feel like we're getting some traction, and I feel like the sponsors of the bill have heard some of the very real concerns with that. Just this last week alone, there was a front page article on the Journal Saturday coming out talking about this bill and the potential implications and everything. And it focused primarily on the financial aspect, because that has been one of the loudest discussion points. But there's so many more to it, as we are all aware. There's, it's looks at creating an unnecessary move where you already have the ability to bring these types of actions under the New Mexico Tort Claims Act. So I think this resolution does a great job of highlighting that. There was also an editorial yesterday that hit that was very, very positive, very strong. That title I thought was amazing. And it was something along the lines of, a bill that seeks a purpose, because the Albuquerque Journal's editorial board really covered it very, very well and pointed out a lot of great things in that article. But in this resolution, just a couple of things that have been highlighted. The commission was very divided. So it was a 5-4 vote with what they recommended. And that has been very much, I would say the media has missed that at a large point, and that has not necessarily been accurately represented in the committee testimony. They make it sound like the commission recommended. Well, when we're talking about a 5-4 vote, as we all know, that's a very close vote. And the 4 that voted against submitted a dissenting opinion. So there was a lot of opposition within the Civil Rights Commission. A few other things just to really kind of highlight on, I would say, was that this new cause of action is unnecessary because the Tort Claims Act, again, already waives sovereign immunity for these claims. There is the ability for plaintiffs to recover damages up to $1.05 million, as we're aware that that's the cap that's set by the Tort Claims Act. The Tort Claims Act really helps to balance, the compensation those damages are able, like by government action, as well as the public good. But a key thing, obviously, for Roosevelt and this state is New Mexico is one of the poorest states in the union and already allows for some of the highest damage awards in the country for state law claims against law enforcement officers. So that to me says a lot. But also, when you talk about eliminating caps and mandating the award of litigation expenses and attorney's fees, I think that really gets to the heart of what we're looking at here. Is the attorneys that brought this forward are looking for a way to get their piece, and they want their fees figured in there, and that can be detrimental. In our county, when we look at what we're able to have in the pool and participate in the pool, that's how we're able to afford good insurance and have this coverage. And we're very fortunate, to have a county like we do with the people that operate within it. We have a very well-run detention center. So I know that we're not seeing the claims like some of these other counties. But when you start talking about these types of claims and issues, it could and looks to create an environment where reinsurance isn't available. So at this point, we have insurance at the $2 million mark through the pool. The pool pays up to $2 million, but then there's reinsurance that covers the next $3 million from the 2 to the $5 million. Well, if that went away, then we would look at if New Mexico, or let's say Roosevelt County, received a $10 million judgment. Well, you heard our treasurer report that we don't have $10 million sitting in the bank and general fund to be able to allocate. So that would mean that would be levied against our taxpayers, our property owners in this county, to collect any remaining balance of that. And that says to me so much, because we're putting the burden on the taxpayers for this. So this really isn't about the real reform that they've been seeking or anything along those lines. It's got such an aspect of the financial implications to it. But I know y'all have reviewed the resolution and you've worked through it. It's, again, what the important part to me that really does this is, again, it in its current form, y'all would oppose it as a county. We would oppose it as a whole because, again, it's unnecessary at the state that it is at. It's not doing anything for real measures of reform, and there's already avenues to seek this. And it's not addressing the root causes of those things that we're looking at. Obviously, it would create a hardened insurance market that could be very detrimental to our county. And when we're talking about what we would look at, why would we add something like this if it's already covered in the Tort Claims Act? But looking at, trying to find the legislature to have the ability to enact caps like the Tort Claims Notice, if it is going to adopt such a thing of this, to where we have the same implications put in. Because we know that while they may report in committee hearings that we only see a couple hundred of these in federal court as it would relate to qualified immunity, which is at the heart of this bill and eliminating it. We would see far more of those cases filed in our state court because the burden of proof in the federal jurisdictional system is far greater than the burden of proof that is required within our state systems. So we know we're going to see an increase. And when you're looking at this, I mean, you have defense attorneys that are able, or plaintiff's attorneys, I should say, trial attorneys that bill anywhere from $300 to $600 an hour. So you could literally have a $1 award judgment and then another $20,000, $300,000. There's no telling what you could have in attorney's fees, depending on the actual hours that the attorneys have worked on that. So this is beyond concerning for our area. Again, we're really trying to work. I know that they have been working with all the media outlets to really try to educate and get that out. And this impacts, another thing to really highlight on is the special districts. So your soil and water districts, your schools, all your public agencies, your counties, your cities, the state government alone. I think this would be detrimental for the state, and all of its entity with what it has to house. So with that being said, I could go on and on. I know y'all are familiar with this, but I do think it's important to hit this. And I know that we do have media that are watching, that we really want to understand just the urgency and importance of really understanding the true impacts that this could have on us. And with that, I would stand for any question. I know some of the commissioners probably have thoughts on this as well.
Chairman, if I was to tell you that I was concerned about this piece of legislation, I'd be lying. Because actually, I'm offended. And I'm looking forward to February 11th when we have the ethics, our lesson on ethics. I consider this bill not to be a civil rights bill. I would more accurately term it the trial lawyer's golden goose bill. It's not going to have any impact on civil rights or deter any criminal activity by law enforcement or teachers or anyone. It's just a way for trial lawyers to get more money. If I was a commissioner, and what I'm learning from looking at the ethics resolution that we passed, ordinance we passed at the last meeting, if I was a commissioner and I passed or initiated legislation that I would profit from personally, that's an ethics violation. But here we have representatives that are trial lawyers presenting legislations that they can benefit from. Personally, I think the very least they should recuse themselves from the voting. Not only are they presenting it, but they're stacking the committees. If you look at how many members that are proposing this bill are on the committees, they're lined up. It's almost the same. About half of the committee's members on the Judiciary Committee were members that are already on that Indian Affairs Committee or whatever. The same people are presenting it. They're in the committees. It's a stacked deck. And I consider it personally be unethical. And I don't know what y'all feel about it, but I also learned that we have a local ethics committee, but I understand we have a state ethics committee. And I would be in favor, and I don't know how y'all feel about it, but I think our state ethics committee, would they have any, it's my opinion it's unethical. And I think it might be possible that could it be recommended to the State Ethics Committee that they investigate this as being an unethical piece of legislation. So I'm definitely in favor of this resolution of opposing House Bill 4. But I think that we're in a poor state of affairs when we have our leaders seeking self-profit at the expense of the public. Thank you, Madam Chairman.
Did you want to reply to that or his question?
No, there was a question directed to me. I'm, if you want. me
Was
to, I
it,
will.
were you asking him on the?
Well, I would ask for a professional opinion.
Well, I guess.
Would it be possible to refer this to the State Ethics Commission as being unethical?
Well, yes, Commissioner Savage, this commission as elected representatives can refer anything you choose to. So yes, to answer that question, whether it would gain any traction or do anything, I don't know enough about the State Ethics Board, their makeup, or what their rules or what they're looking at. I don't know that they look. I assume they look at the legislature, but I'm just not clear. So you're really asking me a question I'm not prepared to answer. So, but yes, you could certainly refer it. Now, whether it would get anywhere, I don't have any idea without knowing more about the ethics board itself and what their mission is and what their role is and what their function is.
Who would know that? I know that.
Well, I
I know that
find out.
Gary Carruthers is our Stewart's appointee, but I didn't know if we should talk to him or it'd be something to pursue. If nothing more than just to blow some smoke and raise attention to the fact that they're
Sure.
of what they're doing.
But the obvious response to it is going to be that, I mean, the purpose of the legislation that's being promoted is to provide a mechanism for reform. You are correct, though, that the unintended, or perhaps as you're suggesting, the intended consequence is that trial lawyers will benefit from that. But there are two parts to that. There is the mission of the legislation that's proposed by the Civil Rights Commission is probably a good one. It's to afford a mechanism for reform. Whether it accomplishes that, whether it's already provided for by statute, as I think has been suggested. I mean, those are all things that people debate, and that's why elected officials like you represent your constituents and you take your position, and then there's a debate about it. Whether it will be an ethics violation, I can't venture a guess on that. But you're right. You certainly have the power to do that.
How would we go about it?
Well, once again, you're asking me something I just don't know. I mean, I assume the commission would have to take a vote on it. One commissioner couldn't do that. We don't have that as an action item on our agenda today, so we could bring it back to the next commission meeting. Would give me a chance to look at that issue a little more and maybe give you a little more informed information about, the procedure to do that. That'd be my suggestion.
Well, I would think that would be a good suggestion. Thank you.
Any other discussion? Okay. Mr. Savage, how do you vote?
I vote yes.
Yes.
Yes. Yes.
Motion carries. Thank you. Okay, consideration of resolution 2021-11, acceptance of special appropriations of state road funds to Roosevelt County by New Mexico DOT. Ms. Hamilton.
Yes, Madam Chair, Commissioners, so very excited to have this resolution. It is the one for $610,000. This is the one that I know myself, Commissioner Greider, Senator Engel, this all started long ago, and then we kind of brought it to fruition in his office in February of last year. And this is money specifically to reconstruct and rehabilitate Sundale Valley Road, 3.75 miles of it roughly. And also included in that is the money needed for the fencing of the east side of North Roosevelt Road AV. I had to get my directions straight. So this resolution is just a formality that's needed by the Department of Transportation. This is a special appropriation by the New Mexico Department of Transportation for a cooperative agreement. It is not part of the local government road funds. This came from the Secretary of Transportation himself.
Okay. And with that, I'll make a motion to consider resolution 2021-11.
I have a
Second.
question. Ms. Hamilton, if we enter this resolution and we agree to it, does that lock us in with any engagements with the Air Force on the road, AB?
The commission has already engaged in that in prior. This was part of the requirements that the commission set forth, was to find ways to improve Sundell Valley and also address the fencing issue. So yes, it goes hand in hand with what the commission has already considered with the Air Force Base when they presented. And the commission already took a vote and approved to move forward with the DAR project with the Air Force Base. So the commission has already engaged in that level.
I must have been absent that meeting.
We have a motion and a second. Do we have any other discussion?
Yes.
Commissioner Greider? Yes. Motion carries. Proclamation designating February 2021 as 211 month. Ms. Hamilton. Oh, I'm sorry, I skipped D. My bad. Consideration of resolution 2021-12, requesting that the New Mexico State Legislature, the Governor's Office, review the rule change enacted by the New Mexico Retiree Healthcare Association. Ms. Hamilton.
Yes, Madam Chair, Commissioner. So this was a resolution that some of the other counties had considered, and I did speak with our local, both our municipality as well as public schools, just to see, because it's across the board, and it is something that we are all very concerned about because it could have a very detrimental impact at this point with the rule change. If those that are under the age of 55 do not retire by June 30th, then they lose and forfeit that ability to have that retiree health care coverage until they reach the age of 60. So we could see that this would actually force a lot of teacher retirements. Municipal, I know that the city has employees that this directly impacts as well. And we do have those employees that started, basically it's anyone that started working for the county under the age of 30. It could potentially have a negative impact. So we just feel like its funding is at the heart of this. And we really think that they need to go back and look, because we know how hard it is to recruit public servants to fill these positions. And there's a national and a statewide teacher shortage. It's not anything we want to add to. And so in the resolution, we specifically talked about at the bottom that it would have, could potentially have an impact on governmental agencies such as counties, cities, and public schools. So I would stand for any questions on that, but that's where the heart of this one came from.
We haven't had anybody write in or call in or anything opposing this, though, right?
No, ma'am.
Did y'all have anything? Do you have anything? Okay. I do need a motion. Okay, I have a motion
Second.
and a second. Commissioner Greider?
Yes.
Yes. Motion carries. Now we'll move to E. Proclamation designing February 2021 as 211 month. Ms. Hamilton.
Yes, this is a proclamation that the commission adopted at the request of United Way last year. This is the proclamation this year. It says, whereas the United Way of Eastern New Mexico 211 program is a free confidential referral and information hotline that connects people of all ages to essential health and human services they need. And whereas 2021 is the 14th 14-year anniversary of the 211 program in Curry and Roosevelt counties. And whereas United Way of Eastern New Mexico has helped over 2,300 callers last year who were directed to community resources when they were in need, whereas 2,343 local families last year were assisted in the meeting their personal challenges on their journeys to stability, self-sufficiency, and wholeness, whereas hundreds of local callers to 211 were directed to resources such as to food pantries, help with utility bills, or transportation, and whereas dozens of local callers to 211 were referred to organizations such as domestic violence shelters, suicide prevention centers, and or rape counseling, and whereas hundreds of local callers to 211 connected with community groups that distribute items such as clothing, household goods, and or furniture, and whereas due to the Game Changer program and COVID-19 relief grants, 211 has been able to provide direct assistance to 703 families in 2020, allowing them to avoid eviction and power shutoff, remaining safe in their homes, allowing them to obtain birth certificates and identification needed to apply for housing, employment, and schooling, allowing them to overcome significant livability crisis. And whereas to celebrate this important free service to our community, United Way of Eastern New Mexico is conducting awareness activities throughout February. Now I, therefore, on behalf of the Roosevelt County Board of Commissioners, do hereby proclaim February 2021 as 211 month in Roosevelt County and congratulate United Way of Eastern New Mexico in their work in providing the 211 service to our area for the past 13 years. We encourage residents to utilize 211 to access needed services.
Thank you. Now, last year was the first year that we did this, correct?
Yes,
And I got to say, I felt really bad because that was the first time I'd ever heard of 211. I'd never even heard of it before, and it does amazing things for our people. And I didn't even know it was out there. Okay. Well, I'll make a motion to designate February as 211 month, as stated by Ms. Hamilton. Got a motion and a second. Anybody have any discussion on it? Okay. Jane?
Yes.
Yes. Thank you, Ms. Hamilton. Okay, new business. Item 7A, discuss the possible action regarding the HVAC upgrades at the Jake Lopez building.
Well, I know everyone, Madam Chair, is nice and toasty, especially you, based on your cute little graphic over here. So
My freezing emoji.
Lael's agreeing with you. It's like we're going to have to start providing blankets to, but we meet with our maintenance supervisor, Mr. Spinks, and had him get in touch with different entities to get an estimate and an idea of what we would be looking at. What he has come back and recommended is that we look at replacing each of these older heaters. There's two options. We can either just come back in with tube heaters and then leave the swamp cooler air conditioning type stuff as it will be in the summer. Or we can look at coming in and putting in an applicable HVAC system for this entire facility to be able to handle the square footage. That we would be looking at right around a little less than 60,000 to be able to appropriately ventilate, heat, and air the facility here. The other thing that he would like to do, I know you're feeling the draft, is taking out this roll-up door and going in. There's no need. We don't ever utilize it to bring anything in. And it's something we've talked about for years in our capital planning. It's just that now with this being the meeting place for the commission meeting for an undetermined amount of time, it would definitely help with the control of the temperature in here. And Gary feels like him and Anthony could actually do this. We could do it internally. So we're looking at just the materials, maybe some equipment rental if we need a lift, things like that. He's estimating that alone would be 10,000 or less. So I wanted to get some direction from the commission as to how y'all would like to proceed on this. There is, again, an option. We could do just tube heaters, and that would be about 15,000, but that's not going to solve the air conditioner needs that y'all are going to have in June, July, August-ish. So it's at the discretion of the commission. At this point, I will tell you if we want to look at doing something this year with the wind farm, this would be a good time to invest in this facility in this way. We would be able to bring forward a budget adjustment for y'all to consider because we would have the revenues available in excess. Like we do have the budget capacity for both the HVAC and the replacing of the roll-up door.
What's your question, Paul?
Hamilton, got my speaker on now.
Good job.
Why can't the CARES Act take care of all the expenses of this? Because we're going to be forced out of our other commission room at the courthouse to meet here and either burn up or freeze to death. Why can't that take care of it?
So the state CARES money has already been disseminated. It was a reimbursement, but I'm happy to look at federal FEMA funds for that for reimbursement as well. Regardless, the commission will have to expend, and because FEMA is very much the same way, it's reimbursement.
Look for reimbursement.
Yeah, we can certainly look for it, and they, if they would reimburse, it would be at a 75% cost share. And we are actually receiving our first allocation. I think our first award from FEMA was just over 8,000. And y'all will see that agreement coming in here. We're going to get just over 6,000 for overtime out of that. So we can certainly look at it. Mhm.
Here, would it be spread out?
Eventually, when our facilities are able to be utilized for recreational type facilities, it's definitely a long-term goal that the commission has had for this facility, as y'all have discussed in our 5-year plans.
I don't think we need a motion or anything, but I would be very up to Gary checking into the HVAC and cooling system for this building.
Well, that's what I just reported
I mean,
on. He's already done that.
He's already got it all in, and
You wanna do that?
60,000
Yes.
will cover it,
Mhm.
and 10, so we're looking at $70,000.
And if y'all would like to take action today, then that would allow us to be able to bring forward that budget resolution and get to work on what we need to do.
I'll make a motion that we go forward with the HVAC system instead of replacing and fixing this door. And I second that.
And I agree with what you said. Good job on the CARES money. Good
Right.
gosh. Okay.
The estimated cost for both so the HVAC replacement would be approximately 60,000, and then the door, Gary is estimating about 10,000, and it should be a little less than that. We may be a little high, but they're looking at doing the work. So total would be about 70,000. Yes. Okay, so that's, bless you. So FEMA, the Federal Emergency Management Act, we have open claims for CARES for everything that goes on with COVID. So we have some overtime expenses that we've been applying for reimbursement and getting. I know Ms. Rivera is working on our next round that has some staffing because there was mandatory leave that we had to afford employees. If they were exposed, all of that can be reimbursed at a percentage of 75% cost share from FEMA if they approve your application. So it's a long process, but we do have the first phase. I believe it went from March to May. That was the initial approval. So we would be able to seek reimbursement for that from this renovation as well. Approximately, yes, sir.
So I'm thinking, yeah, I believe it needs to be done, but what the question comes to my mind is talking about maintenance of facilities. Fairground, I don't understand how it works. But are there other facilities here that might take priority? And do we have a maintenance plan? I understood you talking something about that, but I went over my head. We have a facilities maintenance plan for the fairgrounds.
We do. We actually have a facilities maintenance plan for the entire county, for all of our county-owned buildings. And that is something that I work with the maintenance supervisor to maintain. This is one that has been a higher priority for the commission. It's just been a lack of ability to address it. There are other things that need to be done in the building. At some point, we need to replace all 3 of these doors right here, as you've noticed. And be able to put in an accessibility button along those lines. So this is very much just a phase. It is very much recommended by our facilities, manager. He in particular was the one that said, if you're going to do it, now's the time we need to take out the roll-up door. But the commission also has the infrastructure capital improvement plan, which is the 5-year plan for the county. And this has been part of it with the plan for the fairgrounds. So different buildings have different projects. So for years, re-roofing the pavilion has been one of those things. However, we're having that taken care of. And that was the higher priority than this. But now with the insurance claim, the pavilion has been addressed to where that frees this ability to move up. So yes, sir, it is on the plan, and it is ranked. It has been ranked by the commission as a priority. In that given scenario, it might be. However, we have not used it that way, and instead we've focused this building, as you'll notice, with the painting. We went in here and pulled up the floor last year, repainted the facility. It's been a focus on youth, but not just the 4-H and FFA. They do utilize it, like for the junior livestock sale meal and things like that, but actually, we've had more use with the basketball teams and the volleyball teams and all of those when we don't have enough facilities at all of our public schools. We often have the teams over here. And so with the new concrete floor and the work that's already been invested, pulling trailers in and out is no longer at all what the maintenance would feel like was an option. They came in here and floated and did a very special treatment on this to try to save as much of the concrete as we could after pulling up the floor. But we have not utilized that door for many years. We keep all that in here.
Motion and a second. Any other discussion? Okay. Paul, how do you vote?
Yes.
Yes. 5 yeses. Motion carries. Okay, item 7B, discussion regarding potential grant application for medication-assisted treatment program at the detention center. Ms. Hamilton and Mr. Porter.
Yes, so commissioners, I'll just briefly get started, and this is going to be a quick report in respect of everyone's time, but we wanted to bring this awareness because this is something that Mr. Porter and I have been working on since November. We know that we do have a significant population need based on the addiction that we're seeing within the facility. And the state and New Mexico counties contacted Roosevelt and asked if this might be something that we would be willing to consider and pursue. And at the time, Justin and I were both willing to hear more information and explore it, because if it's something good we can bring back to our county, then we definitely, if it makes sense for the facility, we want to explore this. So this program is specific to the detention center. And again, we've started this process, but I think at this point the state is comfortable with where we're at to actually look at extending us a grant application agreement so that we can continue to move forward. This is federal dollars that are coming into our state through these state entities. And we worked and had latest was last week we had a conference call with members of the grant program itself and several from UNM that are involved in the research and development and the support of this, including one of the physicians that oversees the project, and talking about different things that they do there in Bernalillo County and in other facilities. There are not a lot of counties throughout the state that are yet able to do this. This is very much a pilot program that we would be able to have here. But it is something that we've had those initial discussions, and we wanted the commission aware of where we're at, because again, we do anticipate that the state's looking to offer us a grant opportunity here for this. And it is something initially, it's 2 years for the grant funding with the possibility of continued renewal support. We really are cognizant, both myself and Administrator Porter, of building something and making sure that we have the ability to really sustain it and maintain it. And if we create something, we don't want it to just end when the state makes a different decision, or like, what is our long-term goal and our long-term plans, and how can we ensure that we can continue on if this program is successful? So I would refer to Mr. Porter on a few more of the specifics about the program with our facility and what we're needing to.
So what this program will allow us to do is to take a more active approach in helping people with the addiction, both to opioids and alcohol. There are a couple of medications that the program would try and introduce that we will discuss with the medical teams that will be working with us. But there's a couple in particular that will be able to help with both addiction. And so we're really open to that. They come in multiple forms. So whether it's shot long lasting, or if it's a pill that you can take once or twice a week. So we're doing the research and working with that. This program is meant for inside, but it will also help our community out, because it's very much about continuing care, soft handoffs to community resources and things. It brings a lot of our resources to the table. Myself and Amber will be working with getting a pool of people that will be able to help this program grow and sustain it to the table, so we can start talking about the services that they can expect from us and the things that they can offer us to be able to extend it to the community. So we're pretty excited about it. There's a push right now. There's legislation trying to come out where it's eventually it's going to be mandated that all detention centers and prison facilities have these programs. So being on the front end of it and getting hold of funding and working through some of this will give us some time to really prepare for when those mandates do come down. So I think it's a good opportunity. Amber was able to help us put together that plan. And I think we're in a position to where it will benefit our community and our detainees as well. So with that, I'll stand for any questions.
Chair, I have a question. This program is all voluntarily with the prisoners that come in. They'll have to volunteer to be issued the shot, the pill, or whatever.
Yes, sir. There's some encouragement that goes on. Obviously, when they first come in, our medical will do a screening and try to identify these people in this high-risk situation, or people wanting some help to prevent from going to that point. And then the education will come from medical. One of the positions that we're looking at putting in this position in this program is an educator, so somebody that could come in and teach those programs and talk about addiction and how to avoid it, and then offer the medication as the component. So there's some encouragement. When we met with the program, they said that there are ways for us to use some of the funding to help encourage participation or to reward participation in the program. And so there's some options there with that too. So there's ways for us to help encourage, but yes, they will very much have to volunteer. We cannot forcefully compel people to participate in the program.
Who will be responsible for side effects if something happens to one of the inmates?
Well,
would Roosevelt County in any way be able to be sued if there was a side effect?
Well, I will tell you, to educate you a little bit on this medication, this is not a new medication to the market by any means. These are medications, and some of them you have heard. And I don't want you to be alarmed when I say them, but like methadone clinics kind of do the same things, but it focuses more on opioids. Then you've got Suboxone, what you hear Hear a lot about that from law enforcement because there's street value in it. Those are just a couple of those that have been out there for several years in effective programs. And then there's a couple others, which one is naltrexone and the other one's Vivitrol. And those are two that have been out there as well. Those two in particular help treat both diagnoses for alcohol and opioids. And one of them is geared to be more of a long-term, don't quote me on this, but like 15 to 30 day, you get a shot, and every so often you go back and you get that shot. And that's to help with the urges to use these substances. So
I guess, Mr. Porter, my main question here is the medical provider the one that's responsible for this, or is Roosevelt County the one that's going to be responsible?
So the contracted medical provider that we work with right now, we're going to be working with them and meeting with them. We, as you know, we have liability for everything that we do. We can be sued at any day for any time. Anyone can allege anything. With this program, it is medically and scientifically based and proven. So there could be a potential increase in taking on additional services. But we could argue the flip side as well, that when you have a detainee come in that is in the middle of a really heavy detox, there are a lot of really medically critical things that could happen at that point. So if we could help to provide an alternative avenue that's a little more healthy in that process for these detainees as they come into our facility for longer terms, the medical malpractice will be addressed with the provider that administers that. All the licensure requirements, things like that, as it relates to this type of clinic, will be addressed medically. So I do not see this as any type of a negative impact on the county. Yes, it could increase our risk, but at the same time, we're increasing some vital services to our detainees. Seeing a contract, hopefully as soon as this month. And with that, that will come before the commission. At that point, we will definitely need y'all to take action. We just want y'all to be prepared with what we're working on so that when you do see it, you're well aware of what we have in the pipeline.
Thank you.
Thank you.
Justin, can I ask you a quick question though? When we have someone come into the detention center that is addicted to drugs or something, what do we do, when they're going to be stuck there and they can't get to their drugs? What do we do with them now?
There are programs in place with our medical provider where we do a detox and treatment of what's going on, with the symptoms that they're experiencing. So we provide them some medications right now to ease the symptoms that they're having, ease the detox effects. We're making sure that we're getting their nutrients back up so that their bodies are functioning appropriately. So this is the process that we have right now. These are just a next level of medications that can start helping, and in some can help with the urges to continue to use. So we have a program. It's just very small and limited right now. This would allow us to grow the program to include education and to enable us to do that soft handoff to the community and work with like MHR and RGH to get those services continue, and hope that we don't see recidivism, the people coming back in just because they have these problems. So,
okay, perfect. Thank you so much.
Okay. Thank you.
Contracts, agreements, and procurements. Request for approval of agreement with New Mexico Department of Transportation in Roosevelt County. Ms. Hamilton.
Madam Chair, Commissioners, so this agreement was included in your packet, and again, this goes along with the resolution that you adopted in support of the $610,000 for those repairs. As stated in the contract, there on Sundell Valley Road, the reconstruction of it, as well as the installation of the fencing on North Roosevelt Road AV. I would just ask for your approval.
Yes. I'll second. We have a motion and a second. Anybody have any discussion on this? Mr. Greider, how do you vote? Do we need to vote on it?
Yes.
Yes.
Yes. Motion carries. Okay, 8B, request for approval of NMDR MAFR AV1 North Roosevelt Road AV project. Ms. Hamilton.
Madam Chair, Commissioners, so this is the memorandum of agreement for the project on North Roosevelt Road AV, and this again involves multiple entities, as I'm sure y'all saw in your packet. This is the Air Force, the Department of the Air Force, Cannon Air Force Base, Roosevelt County, and the Federal Highway Commission. Both myself and Mr. Knudsen have reviewed this. This is just the next step to move forward with this phase of the DAR funding, and I would ask for y'all's approval.
Question, Madam Chair. What is the cost of this agreement with Air Base to Roosevelt County? What was our financial responsibility?
We do not have any financial responsibility on the construction of this road. They are simply taking, they're using federal defense access road DAR project monies to install a paved road from US 6084 to the entrance of the base. It's approximately 5 miles.
None of our county employees are going to be putting in. It's going to be a paved road by an outside.
It's contracted out, if I understand. The last time, didn't we, when we sort of met, they have a outside contractor come in and do this.
That is correct.
This, yeah.
That is something that we are developing in terms of agreements with the New Mexico Department of Transportation. At this point, it still will remain a county road as requested by the commission when they initially agreed to do this with the base. That has yet to be determined in terms of the maintenance. Potentially, yes, there could be a requirement for the county to continue to maintain. However, in our conversations with the base as well as state and federal highway traffic, they realize that we don't have the same capabilities of that maintenance. And so that is something to be determined. We have not fleshed out those agreements yet on the maintenance. The state has showed some willingness to partner with us. However, with a new district engineer, we get to start all over on those conversations, really.
I have a question again. If we enter into this agreement and they put in the pavement, like you said, this is not the first, this is just the first step, right, Amber?
Well, the first step, the commission's already kind of worked through those steps. This is the next step. So the next step was for us to secure money to deal with Sundale Valley and the fencing. That was the concern the commission issued, and then this agreement. So now they need this agreement to move forward. They're estimating the total project cost to be about $5.6 million and change, as you've seen in the agreement. If you do not approve this, then you will lose access to these federal dollars for the next no telling how many years. And we will have significant issues with this road because we cannot keep it maintained to the level it needs to be currently with the traffic load that's on it. This road has to be repaired. Like Commissioner Greider can speak to this from his district. This is a very big concern for our area. So yes, I definitely recommend approval so that we can move forward as the next step of this project, but they are using federal monies for this.
Anybody else? Okay. With that, I'll make a motion to approve. Oh, did you?
Do what?
Did you already move to accept this? You
I
didn't?
haven't.
I didn't think so. Okay. I make a motion to approve. We got a motion, a second. All in favor? Yes. Yes.
Yes.
Yes.
Any opposed? Motion carries. Okay, request for approval of sub-grant agreement with Department of Homeland Security and Emergency Management. Ms. Hamilton.
Yes, Madam Chair. So this is the one that we touched on a little bit earlier. This is the first application. We applied for 8,613.01. The Fed share will be 6,459.76, and these are all justified and approved. It's a very lengthy process, and these are the expenses COVID related from the county from from March through May, that the federal government was able to share that cost on. We will continue through these. This will be one of many, hopefully, that y'all will be seeing as we work toward additional cost reimbursements.
Okay. Y'all have anything on that? I was just asking if you had any questions for Ms. Hamilton, and no. Okay. Y'all consider any motions for approval? I have a motion and a second. All in favor? Aye. Any opposed? Motion carries. Request for approval of interim promissory note with the New Mexico Environmental Department Clean Water State Revolving Fund on behalf of Roosevelt County. Ms. Hamilton.
Yes, Madam Chair, Commissioner. So these next two items just go hand in hand. These are required documents that the Environment Department provided after our adoption of the ordinance. And this is in regards to the stormwater mitigation project here at the fairgrounds. Y'all had these in your packets, and I know you had a chance to review them. Again, it's the 0.5% project interest rate that is highlighted in the promissory note. And I can just go ahead and touch on the loan agreement as well, that all of these, again, are just, we need approval of both so that we can move forward with this project. This is $300,000 in grant money that we're receiving, and we're pledging to utilize up to $325,000 of county money. And that has already been budgeted and approved by the commission. So this is just our next phase.
Okay. And we need to approve these both separately, right? Okay.
Madam Chair.
Yes.
I'll make a motion to approve the interim promissory note, Mexico Environment Clean Water Act.
I'll second that.
We got a motion and a second for approval of the interim promissory note. All in favor?
Aye.
Aye.
Aye. Any opposed? Motion carries. And I'll make a motion to approve the interim loan agreement with the New Mexico Environmental Department's construction program.
Second.
Got a motion and a second. All in favor?
Aye.
Aye. Any opposed? Motion carries. No media communication.
So the media emailed and had a couple of quick questions. Now I just have to find them. Okay, sorry. So the questions were, if any of you could comment as to why you support or oppose the reinstatement of the state meat inspection program in New Mexico. If you had anything you wanted to add to that. Have anything they want to add to that?
Oh, I'll add something to that. With the state meat inspection, as Mr. Boone had pointed out, it will open another door for our local farmers and ranchers and smaller farmers and ranchers to have a place maybe to go to the local farmers market, which is very well supported in this state. so they could go have their meat packaged and resold, and they could sell a certain kind. Like myself, I raise registered Angus. I could sell registered beef, or I could sell a certain kind of pork, or I could sell. There's a group of people in the South now of New Mexico raising Wagyu beef. Well, that's a great deal in the stores now. It's how great would that be to go to your local farmer and get it fresh, knowing it hasn't been packaged, shipped, froze, unfroze. Knowing where your food comes from is a big deal with organic now. And then another thing, we all go across the line to get our beefs processed and pay taxes over there. And here's New Mexico missing out on this tax base that would benefit, create jobs, and benefit our taxes. That's why I support the meat inspection deal.
One additional comment, and I think we've hit a lot of this on House Bill 4, talking about why we oppose House Bill 4, but also specifically if you had anything you wanted to add in regards to how behavioral health issues lead to civil rights claims. Specifically in regards to House Bill 4, how behavioral health issues lead to civil rights claims. And I think that we've pretty much already captured that in stating that this bill in its current form does not really hit at the heart of any type of reform. We are seeing a change in the way things are done. It's more of just maybe some imposed consequences, additional consequences monetarily. But if y'all had anything else you wanted to add, I think we've got quite a bit of discussion, but I promised them that I would ask these 2 questions during this.
Well, I'd like to add one thing for the meeting's over with. We need to rotate a speaker over here by Mr. Crowder. Yeah, we get us a longer. I'll go buy some because sometimes it's a little hard to hear down here, especially with our clerk. She may need.
Got your mouth covered up, you can't hear what you say.
Okay.
Anybody got anything else? Meeting adjourned.
And I love down there. What the people that don't have the mask on. And
It's hard to hear.
It's harder to hear Mr. Savage down there because everybody's between them.
Yep. I have trouble hearing him down there and he doesn't turn his mic on, I don't think. But
No,
I have trouble hearing him too.
we got to sign a bunch of stuff.
Well, I got